And now our last guest is Tom Barnett with the University of Rochester Medical Center.
Introduce yourself and the health system and the scope of the health system.
Sure. Tom Barnett, CIO for University of Rochester Medical Center. We are a 6-hospital with our affiliate organization, about 1,400 beds total, about a 900-member medical faculty group. And we also have our medical school, nursing school, and dental school also under the umbrella, so it makes it kind of interesting.
Yeah, I would imagine. So is Rochester, I might get this wrong, is Rochester where Kodak is?
Absolutely.
It is? Okay.
Yes.
So you when you guys talk about the Kodak moment, it's probably not something you guys talk about all that much, given the similarity is I grew up in Bethlehem, Pennsylvania. Bethlehem Steel was the largest employer up until I got to high school, and then they ceased to exist.
Absolutely. There's a lot of history and a lot of deep roots with Kodak in the Rochester area.
Although, I was driving up towards in the Midwest. I drove by a Kodak facility, so they're still around. They're still doing.
Absolutely, they're still around. They're not quite the size they used to be,
right.
But they definitely have focused on a few really specific niches right now and seem to be surviving.
Yeah, that's amazing. All right, so I have 5 questions. I'm talking to 5 different CIOs while I'm here, so we'll splice these together. I don't know. Maybe we'll play Family Feud with somebody at some point.
Okay.
Top 5 answers from CIOs are on the board. All right. So first question: how's your system thinking about digital or addressing digital within healthcare?
The digital from a patient engagement kind of perspective.
Could be patient engagement. Could be physician experience. Could be, the first question is almost purposefully vague.
Okay.
But to be honest with you, everybody went straight to consumer. So if you want to touch on how digital is transforming the clinical experience,
it's almost like those two-way mirrors. If you think about it, I always think of the EMR as it's a panel that sits between two people,
yeah.
And one side of that mirror is what the patient sees. So that's how we're asking them to interact with their healthcare through both a patient portal or any other method that they're using to get data back to their physician. But on the other side of that panel is where the provider's at, or the physician. And we've got to balance that equation, because if you make everything work well on the patient side, you could end up with dissatisfied or overburdened providers as well.
And we've done that.
To a large extent. And to a certain extent. And I think the EMR takes a little bit of a knock in some of those instances. It's almost a case of shooting the messenger. In not every case, but in some cases, because as you know, a lot of that is regulations that are coming out either from Washington or from Medicare, Medicaid, and so forth. So part of that is it's a frustration point for everybody.
So classes, I think Class put together the Arch Collaborative, published their results. And it was interesting how many of these, you can actually look at it now and say, all right, this much of it was self-inflicted. Like we didn't train right, we didn't do it right, those kind of things, or we made wrong assumptions. Mm-hmm. But then there's the other side, which is the technology just needs to come along. I mean, we're on the cusp of a lot of things like voice and voice interaction with the EMR is right there, and mobile digital experience and those kind of things. But we're on the cusp, and so everyone's like, hey, I could do this in my shopping experience. Why can't I do this in my clinical experience? It's like, well,
and it's a more complicated model, obviously, within healthcare.
Absolutely. If Amazon ships the wrong box, no one's.
Yeah, I had a discussion about a year back with an executive who left Amazon, and he's now with a large outfit on the West Coast. And in his mind, he said, I'm going to bring the Amazon model and everything I learned to healthcare. And he said, and the first thing I realized in the first 2 years into that job is that healthcare is people, and it's a very different model from the way Amazon works.
Absolutely. Second question: how do you determine the noise from the signal, the noise to value in the digital space? Clearly, you just got done speaking at Becker's. You walk off stage, you get 10 cards. Now, one of those is going to be, you should absolutely be doing it, but you got 10 cards. So how do you determine, which of these makes sense? How does your organization sort of, is it supply side, demand side? Are you looking at the market and saying that's something we should be doing, or are you just saying, hey, these are the things we need to be successful, and we're going to evaluate based on that?
I think there's a lot, as you know, that comes at you from 360 degrees.
Yeah.
One of the things that we found at the last health system that I was with, that I'm absolutely applying now at University of Rochester Medical Center, is you always start with what problem are you trying to solve. So you're inundated with new technologies, with new widgets, with new everything, but if it's not playing directly into one of the use cases that we're focusing on, that's kind of, not that it's noise, it absolutely may be valuable, but it's not what is a priority for us at that point in time.
Yeah. And I'm always talking to startups where they're like, they absolutely need what I have. I'm like, the timing might be wrong. It might not be the most pressing problem they have.
Mm-hmm.
Yeah, it's hard for people to really understand that there's a lot of problems to solve. It's not.
When you're digitizing and you have to relook at everything from the people process tools perspective end to end in healthcare, it's best to get one thing across the finish line and make sure it works well as opposed to have 22 different unfinished jobs.
Exactly. So third thing, what are the biggest opportunities for health IT right now? If you were talking to CIOs across the board, what's the one thing you would say, this is the biggest opportunity for our health system from a technology standpoint?
From the technology perspective, I still believe analytics is the big one. So getting enough access to data scientists and folks not necessarily from within healthcare who bring experience and other points of view from outside of that industry is one key area that we can definitely see that kind of growth in.
Yeah, I'm going to want to have you on the show because everybody who comes on now, I talk about analytics, and the reason I do is because every health system has sort of a different model for how they're implementing it. It's really fascinating.
And that's I think the big area, but another area onto that maybe might not be as sexy but can have just as big of an impact. Now that the EMRs are rolled out to a large extent, optimization is something that a lot of health systems they need to do, but not everybody knows how to do.
Yeah, that's interesting. So fourth question is, what are the biggest threats to the traditional healthcare system today?
That can be kind of.
You were just on the panel, Amazon, Apple, and I think what Scott Becker was trying to get out of you guys was, is this a threat to you? And none of you would take that bait. You're just like, well, there's so many different changing models. Is this one really the threat?
There really is, and this is the one that I was thinking about. So while I was still in college, I began a job with UPS, and you kind of learned as you were working there how the United Parcel Service, kind of their model worked. At that point in time, UPS was breaking even from a cost perspective on each house delivery that they did. So the key at that point is you want more than one delivery per house because that's where the margin is made. So case in point, Gateway, if you remember Gateway Computers, the cow-colored 3 boxes to a house, those were good deals they had back then. But then there was this company called Roadway Package Service, RPS, that spun up on the side and said, we're not going to do home deliveries, we're only doing business deliveries. Businesses mostly get more than one package per day. So they targeted right in on the most valuable aspect of UPS's business. Fast forward to now. Within the healthcare space, particularly in an integrated development or integrated delivery network, ambulatory and inpatient, it's a very capital-intensive, very costly company or business to be in. From that perspective, when you see the Walmarts or the Amazons or the groups that are spinning up and trying to take telehealth or primary care visits, urgent care visits, they're starting to peel away at things that are part of the overall health system business model. So the threat that I see is enough of those start to peel away, and you're left with, in effect, the hard stuff, the as we referred to previously, the tertiary, the quaternary care things. And once you lose that portal to the patient, the people who own the portal are going to be able to steer where the traffic goes. And I think that's our biggest threat.
I was at an event, and we were sitting around having drinks, and there was a couple CEOs at the table. I remember somebody posed the question of, what's the number one thing you're afraid of? And this one CEO just looked at us and said, that somebody's going to figure out a way to empty my OR. Because if they empty my OR, I can't run the rest of it. I was like, wow, that's interesting. Now, granted, that's a long way off, but I could see
not
that
outside the realm of possibility, though.
Yeah, really scary. How long have you been in this role?
This role, 2 years.
2 years. There hasn't been a CIO yet that has been in their role for 3 years, which will make sense in a minute when I ask this question. But if you could rewind the clock 3 years, what do you wish you had done 3 years ago to prepare your IT organization for today? So, 2 years. Well,
3 years ago to prepare the current.
yeah. So you're the third CIO I've talked to so far. None of you have been in your role for 3 years. I don't know what that tells me, but it's
Well, it's the old adage, right? CIO stands for careers over. Yeah. I think the focus on from an IT shop, they've been so battered, I guess is the word, from so many different directions. There's so much to keep up with, changing technologies, increasing demand. That ability to focus on lean workflow and throughput for an IT shop, I think that ability to focus on what they're doing and how to do it in the most efficient way so that you can do smaller work efforts and deliver work quicker is probably one of the biggest areas that I see the opportunities for in the internal IT shop.
so driving. It's almost the conversation they were just having about AI. It's driving the efficiency higher in some areas. Let's say it's provisioning servers and those kind of things, so that the team can focus on.
Absolutely. I think
value.
the industry has changed so much, the IT industry, not just in healthcare. In older days, not too long ago actually, you could kind of operate in a plan, build, and operate model, and that's the way everything could work. Things are evolving rapidly, and now it's kind of, I think the acronym that I heard is it's more in the, it's the broker, the orchestrate, and the integrate.
Yeah.
And it's this constant cycle of staying abreast of what's out there, being able to integrate it, and making sure that you're putting the right combination of technologies together to have the biggest bang for the buck for the health system.
I was mentoring one of the people at my staff, and he said, "What do I have to do to be a CIO?" I said, "Why do you want to be a CIO?" He goes, "Well, because you get to make all the decisions." I'm like, and I got to step back and say, "What do you think the role is?" And as he sort of described it, I said, "You're describing the chief technology officer. You're not describing the chief information officer." But I think what was interesting is that was 3 or 4 years ago I was having that conversation. I think even the chief technology officer is a people job now. It's a people narrative. How do we orchestrate people? How do we bring people along? How do we change culture? I mean, so there's very few pure technology jobs where I got into this because I love a computer. I love making them do things. There's not as many of those roles in IT anymore. It really is.
A colleague that I used to work with, who's now a CIO as well, he said 5% of this job is the technology.
Yeah.
85% is the politics and the people.
It's a people job.
Yep.
Well, thanks, Tom. I appreciate the time, and look forward to having you on the show in the future.
Oh, absolutely. I would love to.
Well, I hope you enjoyed that. It was a blast making it. I really appreciate these gentlemen coming on and discussing some of these topics with us, given their busy schedules. Most of these people on the show spoke at some point at the Becker's Conference, so I really do appreciate them taking the time. That's all for this episode. Please check out the second episode where we talk to Andrew Rosenberg with Michigan Medicine. Jake Dorst and David Chow are also on that episode as well, and you won't want to miss that. Please follow us at our website, thisweekinhealthit.com. You can follow me at The Patient CIO. Follow the show at This Week in HIT. And please come back every Friday for more news, information, and emerging thought from leaders from across the healthcare industry.